For this year's general election, registered voters need to watch for their ballots arriving by mail in mid-October. Following the instructions, seal your ballot in the envelope provided and be sure to sign the back.
Envelopes without your signature will not be accepted.
Look for your free elections guide in the newspaper or at locations statewide. There are no polling places, so be sure to mail your ballot by October 27th.
Hawaii votes by mail.
Well, happy Aloha Friday. It is October 23rd. I'm Ryan Kalesh Suji, joined by Yenji Denise, and this is Spotlight Hawaii on the platforms of the Honolulu Star-Advertiser. Of course, a conversation that is brought to you by the Office of Elections. We're going to be talking more about the elections in this broadcast, talking to Scott Nago from the Office of Elections to get an update on some of the numbers, as well as provide more information about how you can make sure that your vote is counted in this upcoming general election. But Yenji, we're starting off with some important people in our community that sometimes often go unnoticed, but playing a very big role in the state's effort to combat COVID-19.
Yeah, that's right. We rely on them whenever we are in an emergency, and that is EMS, Honolulu EMS. We are joined this morning by Dr. Jim Ireland and paramedic Sunny Fitzgerald. They're going to be talking to us about what it's like to be on the front lines when it comes to combating the coronavirus and how their work has really changed. Thank you both for being here this morning. Dr. Ireland, we'll start with you. It's been 6 months now. How has the pandemic changed your agency?
Well, good morning. And for those of you who don't know, I started in Honolulu EMS in the very early 90s as an emergency medical technician on the ambulance. I was back in 2010 as the director, and now for about a month now, back as the chief of EMS. And when the pandemic started, I was in private practice, also working with a private ambulance here, American Medical Response, as well as doing some work with the airport, and was just as surprised as everyone else when this really came on, at first quite gently, and then as we started getting cases here, the level of concern raised and was life-changing for everyone in the state and really in the country. But with respect to the healthcare, EMS, prior to me getting here, did a wonderful job of getting on with best practices, PPE, protecting the paramedics, and also learning with the rest of the country, especially the medical field, how to take care of patients with COVID, because again, they're on the front lines. They're seeing them often before they go to the hospital.
And Sunny, a question for you. What are you seeing, in your response as someone who's on the ground, and how has COVID sort of changed the way in which you're responding to those in need?
I would like to say good morning too. Things have changed a lot. I've been in EMS for 5 years. When I first started, there was no wearing your mask when you got out of the ambulance. It was you put your gloves on and you put your stethoscope on and you go and respond to a call. Now, our entire response has changed. Our dispatchers do a great job of giving us a heads up when we're going to somebody that is COVID positive. But, it's hard to say nowadays. We respond as if everybody is possibly COVID positive. So when the call comes in, our dispatchers give us precautions that we should follow. As far as on every call, we're wearing our N95s, our eye protection, face shields, gloves, and gowns as necessary. So things have definitely changed a lot from when it first started.
Yeah, Dr. Ireland, I would love for you to speak to that. And we actually have some photographs that your agency shared with us so we can see just all of the gear that is necessary. Can you tell us a little bit about the cost of all of this, what that's doing to your bottom line? I would imagine that CARES Act funding is covering it now, but that, of course, does run out at the end of the year. Yes,
and I'll just take you back a little bit on history. When I first started in EMS in the mid to late 80s, the old timers or the older folks in EMS in the department generally a lot of times wouldn't even wear gloves on calls. And then in the 80s, unfortunately, we were faced with a new disease called HIV or AIDS, and there was concern at that time about transmission and how to protect yourself and your paramedics. And so that was really the first time in EMS people really started wearing universal gloves, and because prior to that it was intermittent, and so that was a universal precaution then. And now here, fast forward 30 years later, now we have other precautions as the illnesses and diseases in the community dictate. As Sunny said, there's a wide range of things people wear, like the gowns, the special masks, N95, gloves, goggles, face shields. And when this pandemic first hit, mostly, first obviously in China and then more in the mainland than it came to Hawaii, we were all very, very concerned that healthcare providers were getting infected and unfortunately dying. And this included doctors, nurses, paramedics, EMTs. And so we were very, very concerned. And there was concern of getting infected and bringing it back to family members. And I think across the country in EMS, there was a lot of anxiety about this. Now, fortunately, with these practices, they do provide a very good level of protection. And what we found in our department is we have transported over 500 patients with known COVID-19 infections, and probably double or triple that we didn't know had COVID-19. And, fortunately, knock on wood, we've only had one paramedic that we know of infected with COVID-19 out of over 500 transports. So it's a testament to the preparation that our department's done, to each and every member in the field that's putting on this gear, and also our dispatchers who are giving us the pre-arrivals, the warnings. So we're very, very fortunate and pleased that all this is working. Now, to get to your question, yes, it is more expensive. We are using more equipment. We've bought special decontamination solutions, decontamination equipment to decontaminate the ambulances after these calls and regularly in between calls. And all of that, fortunately, was funded with CARES money. And we have a surplus to carry us into 2021 once the CARES funding we anticipate running out. So I think we're in a good position, and our hope, like everybody else, is that a vaccine will come in the next few months, and hopefully 2021 will look a lot different than 2020, which I think a lot of people are ready to be done with, to be honest. And
just a quick follow-up on that. So you folks are planning to continue to incorporate this type of equipment on all calls moving forward into 2021, and will this become sort of the practice in what you guys have to do moving forward for the foreseeable future?
That's a great question, and I don't know the answer to that. I think once people are vaccinated across the board, the first responders, community members, paramedics, I think we'll be able to relax a little bit, because even if COVID's not eliminated, we anticipate people will at least have antibodies and be protected. Just like when hepatitis B vaccine became available, that was a bloodborne virus that could be transmitted by blood. All first responders get vaccinated for that, and actually all babies for that matter now. And now we're not worried about hepatitis B. So there could become a day where we don't have to, quote, worry about COVID-19, and hopefully that's sometime next year. So I anticipate us relaxing the restrictions significantly back to kind of what we were last year, but that remains to be seen. Another thing I'll just add, and actually I'm going to let Sunny talk about this. It affects the way we interact with our patients and the human touch that we wanted to provide as providers to somebody in need, and maybe Sunny can talk about that.
Yeah, I'd like to add to that. Definitely, we do this job as paramedics and EMTs. Our primary goal is to take care of our patients, not only our patients, but their family members and whoever's on scene when we get there. So like Chief Ireland was saying, a lot of times, say we go to a pediatric call or a kid, we come in with our gowns on, our masks on, goggles. We look very intimidating. We look like Ghostbusters coming into your home. So it does affect how our interpersonal relationships are with our patients. I think I can speak for most people in our department that we do this job because we love helping people and we love helping our community. So it does affect our day-to-day practice and how we run calls. And, the masks we're wearing and the P100s, our respirators, it's very hard to communicate. It muffles our voices. So a lot of times we're having to yell when typically we wouldn't be yelling at our patients, So it definitely changes the way we do things. Unfortunately, it affects the interpersonal relationships that we have with our patients and their families.
Yeah, I mean, it's such a difficult thing to have to, but there is no choice. Dr. Ireland, I wonder if you could speak to the response times and how this may change it. I'd imagine that if you have to suit up before every call and then clean the rig and do all of that, we know that EMS, the resources are stretched pretty thin across the state. Can you tell us a little bit about how this may be affecting response times?
That's absolutely correct. The paramedics and EMTs do have to gown up before they get to the call, and so you may take an extra 30 seconds to a minute to get all that gear on. And first responders too. The fire department is also taking these precautions, and so all the first responders, when they're going, especially to a known call with a suspected COVID patient, there is a little time, and I don't think it's a lot of time, but it's a little time. But you're absolutely after the call. There's a large kind of a protocol as far as decontaminating themselves, decontaminating the ambulance, making sure it's clean for the next person who has to get in that ambulance for the next call. So there is a back end time that's keeping the ambulances out of service a little longer. Now, fortunately, because of this and because of the way society has changed over the last 4 months, particularly with the amount of people on the road, bars being closed, tourists not being here, our call volume is actually overall down 10 to 20%. So I think that's been mitigating the extra time it's taking to decontaminate and get the ambulances ready again. It's kind of balancing out. However, restaurants and bars, I think, will be opening back up if they're not already. People will be coming back to the islands, the tourists, and we're getting back to normalcy, which then what brings with that is we're going to get back to our kind of old call volume being very, very busy. And so I think over the next 3 to 6 months, we'll see maybe that increasing in call volume back to baseline, in addition to the extra cleaning procedures, creating a little bit of stress. And so what we've done for November is we've actually are going to staff an extra 8-hour ambulance in the peak of the day for the month of November to try to mitigate some of that stress on the system, so we don't delay our care, taking care of our patients.
Sunny, I'm wondering if you can sort of take us through what it's like as someone, Dr. Ireland explained earlier that you guys have transported nearly 500 of these COVID patients. As someone who has experience doing that specifically, of going into a home knowing that someone has been infected, can you sort of explain that process in terms of the condition that they're in? At what point are they calling EMS to get involved to be transported, and talk us through what that process has been like for you and what you've experienced?
Yeah, so like I was saying, a lot of times we don't know if it's COVID positive or not, but in those cases that we do know that our dispatchers can give us that information that it's COVID positive. In most cases, we're going to be putting our PPEs on before we respond to the call. And I'd like to say, yes, in the beginning, it was taking us a little while to get used to donning all our PPEs, but we have gotten much more efficient at it. The more you do it, the faster you get at it. So as far as delaying our response times, I don't think there's much delay in that, So when we get the call, when we get into a patient's home, a lot of people are very forthcoming with, yes, my family is COVID positive. So we're going in with all our PPEs on. As far as how it affects each individual, it's very different. Some people are having the shortness of breath, the fever, chills, cough, and then some people are having the nausea, vomiting, unable to keep food down. And as far as when people are calling 911, I'm sure everyone can feel the difference between, when is an emergency and when is not. But regardless of when they decide to call us, we're always there to help them. It can be as bad as somebody not being able to breathe, and I don't really think people understand how much we can do pre-hospitally to help these patients. We're a very progressive EMS system in the fact that we, in our standing orders, we're able to actually breathe for you, and we can actually intubate you, meaning we use a device we insert into your mouth, and we can insert a tube into your trachea and deliver oxygen directly into your lungs. Now, that's obviously an extreme case, if somebody is unable to provide oxygen, start IVs, give you
We seem to be experiencing some audio issues with.
Yeah, we kind of lost her there, but what she's saying is that endotracheal intubation that the paramedics do is an extreme measure, but it does treat someone who's in respiratory failure or respiratory collapse, and the paramedics actually use a device called a laryngoscope to put that endotracheal tube right into the trachea, and then we can, paramedics can breathe for the patient, and then they put them on a ventilator once they get to the emergency room. So that would be the worst case scenario for anyone in respiratory failure, whether it's from COVID or heart failure or cardiac arrest or a drowning. But that tool is something our paramedics use in the very, very severe COVID cases. And one of the things we, with our CARES money, purchased for all the paramedics, and we're distributing those to the ambulances, is actually a video intubation device. And so, whereas before they would just do it with a manual laryngoscope or a tool to open up the airway, we have purchased a video laryngoscope or a tool with a little video camera on it to help them insert that airway for those COVID patients. Because again, they are doing this with the gown and the mask and the goggles and the shield. And it's a process where you have to kind of look way down. I'm going to do this for the camera. And you're looking and you're trying to look into the mouth and get this tube in the right place. And we think the video will help them with that. And Sunny, we couldn't hear you, so I finished. You got cut off. So I just finished the talk on the intubation.
Our time is running out, but Dr. Ireland, I wondered if you could, before we go, speak to the issue of recruitment and personnel issues. Of course, the people that work for you are highly trained and very, valuable to our community. But it does sound like the work with COVID, adding that layer, has made a stressful job, perhaps even more stressful. How are you doing in terms of retention, and are you looking to hire more people? And if people are interested, what would you tell them about the job?
It's a great job. It's a great career. The city has great benefits, and it's very, very rewarding. And we have a great team. Our paramedics, EMTs, and dispatchers are so good. Call KCC, Kapiolani Community College. They have the training program, and those folks get trained to the point where they can come right over to our department. They don't need another academy. They don't need additional training. Of course, we do an orientation, but almost all of our personnel come through the Kapiolani Community College EMS program, and I think they have a website and a phone number you can call. It's interesting because healthcare, it is a scary time to get into healthcare because of COVID, but at the same time, we've lost a lot of other jobs, hopefully temporarily. And healthcare is oftentimes a safe place to work in the sense of job security when the economy is otherwise a little unstable.
All right. Well, Dr. Ireland and Sunny, thank you very much for joining us here this morning and for being a part of this conversation and for, of course, the work that you guys continue to do on our front lines. Thank you so much for joining us.
Thank you.
Thank you. Wow, interesting to hear about all the challenges there. And, you see those pictures and they really have to do so much just to respond to a call. And the fact that they've responded to that many COVID calls and only so far one paramedic has tested positive to COVID is, of course, as he said, a testament to all the protocols that they've been taking.
Yeah, and just the change in operations and how they have to respond to these calls, and knowing that sometimes they are going into a COVID case and sometimes unsure. But always being prepared, and certainly the unspoken hero a lot of times in just our community on a normal basis without COVID, and to add all this in, obviously showing that they are very important and critical to the well-being of our community. We're going to sort of switch gears here now and talk about, of course, something that is coming up, and we've been talking about it every day on this broadcast, and that, of course, is elections. That's
right. Scott Nago from the Office of Elections is joining us now, and interesting to talk to him about a few things. Thank you so much for being here this morning. First off, people have been voting for weeks now. We've been telling them to drop those ballots. How many ballots have you received so far?
So statewide, as of yesterday, we received over 344,000 ballots in the mail. Or 344,000 people have cast their ballot. So that would roughly be about 41% if election day were today.
Wow. And, sort of speak to that. I mean, where are we in terms of maybe comparing it to other years? Of course, we know that this is the first time for an all mail-in ballot, but just the numbers in general, what are you folks projecting? And if you can compare that, of course, with other years, but also what you saw in the primary.
So in the primary, we saw an increase in turnout. We had about 51% of registered voters cast their ballot. General elections are usually always have a higher turnout, so we're not expecting this one to be any different than the primary.
Well, if you've already received that many ballots, do you have any projections in terms of how much participation you are expecting?
You know, it's really hard to tell, this being the first elections conducted entirely by mail, so we really don't know what the trend is yet. We'll probably know more next election based on the trend this year, but we really don't have anything to base it off of this year.
We know that there are some important deadlines that are coming up. If you can sort of talk through and just help to educate those who may be tuning in about some of those key deadlines coming up and additional ways in which people can continue to make sure that their vote is counted.
So everybody should have received their ballot in their mail. If you're going to mail your ballot back, do so by the 27th of October, that's this week, next Tuesday, if you're going to place it in the mail. If not, you can go to a place of deposit to drop it off, or you can go to a voter service center to vote in person, and you can find a list of those at our website, elections.hawaii.gov.
And let's talk a little bit about those voter service centers. What if, for whatever reason, I skipped out on registering to vote? Hawaii still does have same-day registration. Can you tell us about what you need to bring if you want to register same day, and what that process is like?
So if you did miss the registration deadline, you can still register, but you'd have to do it in person at a voter service center. We have 8 voter service centers statewide. You would go there, you would fill out a registration affidavit. As long as you didn't vote, or as long as you're properly registered, you'll be allowed to register and vote in person on the same day.
Okay.
You know,
sorry, go ahead, Ryan.
Yeah, in the primary election, we saw those individuals running to those boxes just at 6 o'clock. That a lot of people just making it. What is in those situations? Is there a hard deadline at 6 o'clock? Were you receiving and taking some of those that may have come right after the 6 o'clock deadline? And how are you managing that moving forward into the general election, knowing that some people may potentially be doing the same thing?
Yeah, so if you still have your ballot, we're asking you to either mail it by the 27th or drop it off. Don't wait, do it right away. Hawaii does have a hard deadline, so ballots must be received by 7 p.m. on election day. Received, not postmarked. So it has to be in the possession, so it has to be in a place of deposit at 7 p.m. by 7 p.m. or it has to be received by the clerk's office by 7 p.m., not postmarked.
Do you know from the primary how many people did miss the deadline? I would imagine that you did get some ballots after the fact.
It wasn't very much. It was about 1,000 ballots statewide that didn't make the deadline.
Okay, but we are talking about some races that are, especially some of these smaller races, House seats and whatnot, where, a couple hundred votes can be the difference. We saw, of course, with the city council in the last go around with Tommy Waters and Trevor Ozawa. It's just a handful of votes that can make the difference. So make sure you do get that on time. We want to talk about actually counting votes. We understand that you've started to process the ballots. Tell us a little bit about that and when the actual count begins.
So since we moved to elections by mail, the law allows us to begin processing ballots 10 days prior to elections. So that would be starting tomorrow. We'll start processing ballots. We won't release results till after close of voting on election day, but we can start the process of opening up the envelopes, running them through the scanner, just not releasing results.
But you will actually be counting the votes.
We'll be counting it. We just won't be calculating it and releasing any kind of results.
And so when we get that first printout, so to speak, that comes out, that will sort of be the reflection of everything that's been received up until what point. So, when that first printout, what is that going to account for? Because I'm imagining that's going to be a pretty large number there.
So in the primary election, the first report that was released shortly after close of polls contained about 90% of the votes. What we hope it includes for the general is everything up until that day. So everything we received in the mail up until at the close of business on Monday. And then the next report would be what the voter service centers and anything we received in the mail or anything we received in a place of deposit on election day.
At the national level, we see a lot of people on, different politicians kind of casting dispersions on the idea of voting by mail. How has Hawaii's experience been thus far in terms of the sanctity of the vote and making sure that there's no fraud and what have you. Can you talk a little bit about that?
We've always had a higher utilization of absentee mail ballots prior to voting by mail. Ever since 2014, more voters actually chose to cast their ballot prior to election day than at a polling place on election day. So we've basically been doing this. All envelopes require a signature on the back. That signature is matched up to the voter's signature. If it doesn't match, now this year we have a new law that says voters will be notified and they have up until 5 days after to correct it. So if you don't sign your ballot, it won't be counted. If your signature doesn't match on your envelope, it won't be counted, but you will be notified and you'll have 5 days to correct it.
And so you folks are having to actually make sure and then follow up with those individuals, and they should be contacted should that be the case, correct?
Yes, they will be contacted by the clerk's office to let them know that their ballot hasn't been accepted. Also, if a voter wants to know if their ballot has been accepted, they can go to our website, elections.hawaii.gov. We have a track your ballot feature where they can enter in where they can log in and see if their ballot has been accepted or received. They can also download their virtual I voted sticker at the same time if their ballot has been received.
I know it's probably too early and there'll be a lot of post-election analysis on this, but just judging from the primary results, are you able to figure out who is voting in higher numbers because of mail-in ballots? Is there a particular demographic that participates more? Have you actually, sussed out those kinds of issues, or is it just sort of, you look at the broad numbers?
No, right now we just look at the broad numbers. After the election, we'll get into analyzing who voted actually higher or who used mail more. But I can tell you that in the past, the 65 and older population is the one that actually does vote by mail more than any other age group.
Wow. Well, our time here is coming to an end. Do you have any final thoughts or any words for the viewers that may be tuning in sort of in this last push leading up to the general election?
So if you do have your ballot and you do plan to mail it in, do so by Tuesday. If not, take it to a place to deposit, or voter service centers are open right now, so you can go to a voter service center, drop it off, or vote in person. But don't delay to vote today.
There you go. Good message. All right, Scott, Nago, thank you so much for joining us and providing that update. And we look forward to seeing, I'm sure, more of you as we get closer to the election, and of course, for those results on election night. Thank you.
Thank you.
Wow, Ryan, that's so interesting. As people who have covered elections in the past, for those of you who aren't familiar, of course, there's printouts that come. The Office of Election releases numbers, voting totals, right when the polls close, and then there's usually an update a few hours later. But to hear that 90% in the primary were tabulated in that first printout, that really says a lot, because by then you could have results right away. You don't necessarily have to wait.
Yeah, so that's really changed just the overall election night experience. Not only the way in which the media is reporting them here locally, but also the way the campaigns are managed. And of course, it's so different now with COVID-19. We're not seeing these large rallies. We're not seeing these gatherings with parties and celebrations happening because of the restrictions. But you can kind of really get a gauge right off the top of how that night is going to project should the race be close. And obviously, you're going to be waiting, but a lot of winners will be determined shortly after that deadline closes. And really the only other remaining votes that need to be counted are those, as Scott said, that came in on election day itself. And so it's really changed the way in which we experience election night here in Hawaii.
Yeah, and what's interesting, though, for the races that could be very close, if there are a large number of ballots that they receive that have errors on them, let's say the signature is off or what have you, we did hear him say that they do contact the voters and they have up to 5 days to correct that issue. So if we're talking about a certain district where the race comes down to, a handful, less than 100 votes, as we've experienced here in the Hawaii in the past, that could present a really interesting challenge, and there could actually be a very long wait. So interesting to hear about the different dynamics. But as he said, make sure you sign the envelope on the back. We've said it a lot of times. You can go to the State Office of Elections website to find same in-person voting services. He said that there are 8 voting centers now open, so you still can register to vote same day, and make sure that your voice is heard.
And if you did receive yours in the mail, make sure that you get it back to and mail it out by next week, Tuesday, to make sure that your vote is counted. And you can also visit the election website to really track your vote, which is something new that you can actually see if your ballot was received by the Office of Elections. You can head over to elections.hawaii.gov. Yenji, another exciting week. Next week, we got some special guests that will be coming on that will continue on in our conversation, of course, in the state's response to COVID-19.
Yeah, this is really based on a lot of your suggestions. We'll have Lieutenant Governor Josh Green on Monday, but then on Wednesday and Friday, we have two guests that we have not had in the whole time that we've been doing this, and we've been doing this since the first lockdown. We've asked HPD to join us, so Deputy Chief John McCarthy is going to join us. He's going to be talking about COVID-19 violation enforcement, and this is a very hot button issue in terms of enforcing quarantines, mask violations. We see obviously the Surgeon General facing his own COVID-19 citation. So what is HPD doing when it comes to enforcement? The mayor's got a very strict system under that tier, so we're going to be talking about that. I think that will get a lot of feedback. And then Major General Ken Hara is joining us on Friday.
That's right, and of course, he is in charge of HIEMA and overseeing the Hawaii emergency management system, specifically in terms of reopening the state and really working with the Lieutenant Governor on those the pre-testing travel kits, the pre-testing travel tests that had to be taken by those coming into the state. He'll be talking a little more about that, and of course, the evolution of the state's testing program as they continue to not only open to outside travelers, but also the inter-island quarantine periods. And so we'll be talking to him about that and how the state's response moving forward.
We know a lot of you are enjoying lifted restrictions now that we are in Tier 2. We invite you to have a very safe weekend. Stay safe. Of course, socially distance, wear a mask, follow the rules. Otherwise, we'll be talking to Chief McCarthy about you. But until Monday, we wish you a fond aloha. Again, we will be here 10:30 with Lieutenant Governor Josh Green.
Aloha. We'll see you then.
For this year's general election, registered voters need to watch for their ballots arriving by mail in mid-October. Following the instructions, seal your ballot in the envelope provided and be sure to sign the back.
Envelopes without your signature will not be accepted.
Look for your free elections guide in the newspaper or at locations statewide. There are no polling places, so be sure to mail your ballot by October 27th.
Hawaii votes by mail.